Flu deaths in North Carolina are rising and rising fast.
Just last week, 30 more people died from the flu, bringing the total to 54 deaths. 4 of them have been in Buncombe County.
Tonight, Governor McCrory is urging all North Carolinians to get the flu shot. News 13's Kimberly King has more on what local hospitals are doing to take precautions.
Larry, the 2 we went to have visitor restrictions in place. In one case, no one under 12 is allowed in and only immediate relatives, as emergency rooms are on alert for patients coming in with the flu.
It's extremely hot. It's uncomfortable.
But Brandon Nelon, one of 2 staffers at Park Ridge's ER's front desk, isn't taking any chances, continuing to wear a mask to minimize his risk of getting the flu again.
I had it last week myself, and it is horrible.
Brandon came into his own ER as a patient last Tuesday. Testing positive, he was out all last week.
I am happy to be back at work.
Lots of positive flus.
Ann Skinner is one of many physician assistants here, seeing a record number of patients testing positive for the flu. She says the masks help.
Well, it reduces the risk of transmission, as does frequent hand washing.
At Mission Hospital, signs notifying visitors of restrictions are everywhere as you come in. At the visitors' entrance, the signs are taped on the front doors.
We are limiting visitation. We've asked that children under the age of 12 years old, stay at home and just call family members if they need to communicate with them.
Dr. William Hathaway is Mission's chief medical officer.
Increase in incidence of flu statewide.
But there is some good news in Buncombe County schools. After looking at today's numbers,
we're actually seeing some declines in absences from mid-December.
David Thompson, Director of Student Services, is encouraged that the worst, at least in their school system, may be over. But Thompson still has one request.
We absolutely want everyone who can to have that flu vaccine.
Health officials say the vaccine this year is not working well because it doesn't match the dominant flu strain. Flu deaths in North Carolina are now higher than they were at this time the last 2 years.